and have you ever done this before? You meet somebody who you're convinced has, let's say, borderline personality, and you put them on an SSRI because they come in with MDD, they're depressed. And then 6 to 8 weeks later, their depression is gone, and they're not borderline personality anymore. Have you ever seen that? Doesn't happen a lot. But state versus trait. When you're depressed, anxious, socially distressed, we all regress, right? We get a little more narcissistic, a little more obsessive, a little more dependent. Our patients do this too, right? You clear out the axis 1 depressive disorder, and they're not as stressed, and then their traits are gone, right? Or they don't have full-blown disorder. It's like remarkable, and you were going to commit somebody to years of psychotherapy because you're sure they're borderline personality, where they just had the traits and they regressed, right? That happens too. So again, that's the dimensional side. That would be the kind of weakest side of personality disorder as far as symptom severity. It's only when you're stressed do you see it. So maybe ask questions about that. Do you really, kind of do this entitlement, angry thing when you're not stressed and depressed? And some patients have the wherewithal to report that to you. So why is it bad to have a personality disorder? Worse adherence to treatment, worse treatment response, particularly to medications. You have more recurrence of depression and anxiety. Risk of suicide goes up. You don't do well at work. You don't do well at home, right? Increased violence and impulsivity. So having a personality disorder as a psychopharmacologist, to me, levels the playing field a little bit, right? So being traumatized, you heard about this, changes your brain. Right? You're not going to respond as well to medications. Having a personality disorder, some have trauma, some don't. I think brains are different. I have a couple of slides on that. They tend not to respond as well to meds, right? Being addicted, smoking weed 18 times a day, you're not going to respond as well. So addiction, trauma, personality disorder, in my world, the treatment-resistant depression, those are the 3 culprits that most of the time lead to treatment resistance. Yes, you can meet a patient as none of those things. They have horrible to treat depression. It's like cancer, diabetes, blood pressure. They're just some almost untreatable conditions, right? So some people just have bad depression. But if you really go hunting for it, trauma, addiction, personality disorders really makes our medicines work suboptimal.